Namaskar, I am Dr. Basudev Pokhrel, consultant hematologist, hemato-oncologist and bone marrow transplant physician at Asvins Hospital. Today I am going to talk few things about hematology. What is hematology? Hematology is a newly emerging branch of medicine that deals with various blood-related disorders. Basically, what does a hematologist do? As a hematologist, we diagnose various disorders related to blood and also related to immunity. We diagnose and treat anemia like iron deficiency anemia, which is very common. We diagnose various type of blood cancers like leukemia, lymphoma and multiple myeloma. We also treat various bleeding disorders like hemophilia, and we give chemotherapy for various blood cancers like acute leukemia, myeloma, etc. Sometimes when the standard chemotherapy doesn't help our patient, we also do bone marrow transplant like aplastic anemia. Though it is a benign hematological disorders, sometimes we may have to do bone marrow transplant as a curative treatment. When you consult a hematologist, for example, basically when there are some symptoms suggestive of hematological disorder, you do a complete blood picture, and any abnormality in the blood test, you have to take the help of a hematologist. For example, you have a continuous fevers which is unexplained by any other causes. You do a complete blood picture as a part of evaluation, and your WBCs are either very low or very high. That time you have to suspect there is something wrong related to blood, so you have to take the help of hematologist. Sometimes there are abnormal swellings in your neck or armpit. In that case, you may have to take the help of a hematologist. Sometimes there is problem in the blood clotting, like you had a minute injury in your body part and your blood doesn't stop, it bleeds continuously. Then you have to think why it is doing so. So you have to take the help of a hematologist. The hematological disorders basically can be divided into two spectrums. One is benign hematology and another is malignant hematology. Benign hematology deals with non-cancerous diseases related to blood like anemia, like iron deficiency anemia or vitamin B12 deficiency anemia, which we commonly call as nutritional anemia, or hemophilia or ITP, immune thrombocytopenia. These are the benign hematological disorders. The other spectrum of hematological disorder is the malignant hematology, where we deal with the blood cancers. Blood cancers usually include acute leukemia, chronic leukemia, acute lymphoid leukemia, which is common in children, and acute myeloid leukemia, which is usually common in elderly people. And some precancerous lesions, which are not actually the cancers, but they can progress into cancers later on, like myelodysplastic syndromes. These are also included in the malignant hematology. So, as a hematologist, we deal with both cancerous as well as non-cancerous disorders related to hematology.